we will discuss patient admissions, transfers, and discharges. The learning objectives for this presentation include the following: differentiate between routine and emergency admissions. Describe the role of the admitting department. Identify the elements included in a patient's orientation to the nursing unit. Discuss key information included in discharge forms for patients transferring or going home. Explain procedures for discharge instructions and documentation of death. Orient and admit a patient to the nursing unit. Assist with admission assessments and patient transfers. Use effective communication for safe handoff between nurses and facilities. Collaborate with the social worker to plan discharge needs. Demonstrate compassionate interaction with the family of a deceased patient. Let's review routine admissions, which are the most common and least urgent type of hospital admission. Routine admissions are scheduled in advance, meaning the patient and physician have had time to prepare for the hospital stay. This could be for a planned surgery, a diagnostic test, or treatment such as chemotherapy or physical rehabilitation. Because these admissions are arranged ahead of time, the nurse can review the patient's medical history, verify consent forms, and ensure that any required lab work or testing is completed prior to admission. It's important to note that the physician and patient both agree to the admission. This shared decision-making helps ensure that the patient understands why the procedure or stay is needed and what to expect. As an LPN, you will often be the one explaining pre-admission instructions, reviewing medications, and preparing the patient for their procedure or treatment. The final point says that the patient has had a short time in which to make the arrangements. This could be worded more clearly. Routine admissions usually allow adequate time for planning. However, there may be cases where a physician decides fairly quickly to admit a patient for observation or a scheduled procedure. It might be clearer to say, the patient has had time to make the necessary arrangements prior to admission. For same-day or day-stay surgeries, many hospitals now have special outpatient or short-stay units. Patients typically arrive a few hours before the procedure, and after a short recovery period, go home the same day. If their condition changes and they can't go home safely, they are admitted to an inpatient nursing unit. As a nurse, you would monitor for any complications or changes that might require an extended stay, such as difficulty waking from anesthesia, abnormal vital signs, or uncontrolled pain. Emergency admissions are very different from routine or scheduled admissions. These admissions happen without any prior planning, often suddenly and unexpectedly. Patients arrive in the emergency department because of a sudden illness, injury, or a rapid worsening of an existing medical condition that requires immediate treatment. Examples include heart attacks, strokes, severe allergic reactions, motor vehicle accidents, or complications of chronic diseases such as diabetes or COPD. As nurses, it's important to recognize that emergency admissions are highly stressful for both the patient and their loved ones. There is usually little or no time to prepare emotionally, financially, or logistically. Patients may experience fear, confusion, and anxiety about their condition or outcome. Family members often feel helpless or overwhelmed. These stressors can directly affect how the patient copes, communicates, and even responds to medical treatment. In addition to fear and uncertainty, patients may worry about unmet responsibilities such as childcare, employment, or caring for dependents at home. As LPNs, part of your role is to provide reassurance, explain procedures clearly, and support both the patient and family during these critical moments. Emotional support and clear communication can reduce anxiety, promote trust, and improve cooperation with care. The admission process outlines the requirements and steps that must be met before a patient can officially be admitted to the hospital. Every healthcare facility has specific admission criteria. These are the medical and administrative standards that determine whether a patient qualifies for hospital admission. For routine admissions, these criteria must be met in advance of the patient's arrival. This allows time for proper coordination between the physician's office, the hospital, and the patient's insurance provider. Admission criteria often include authorization for admission, also known as pre-authorization or prior approval. This means that the patient's insurance company has reviewed the reason for admission and has agreed to cover the cost. Usually this process is managed by the physician's office, which communicates with the insurance company and provides necessary documentation such as diagnosis codes, test results, or procedure requests. Some admissions also require pre-admission testing, which may include laboratory tests, X-rays, or EKGs. These help verify that the patient is medically stable and safe for surgery or hospitalization. As an LPN, you may assist by collecting specimens, reviewing lab results, or confirming that pre-op testing is complete before the patient is admitted. The slide also includes an important concept: denial of authorization. This occurs when an insurer refuses to accept financial responsibility for a hospital stay or procedure. Denials may happen if the service is not deemed medically necessary, not covered by the policy, or if required authorization was not obtained ahead of time. For example, a purely cosmetic procedure would typically not be covered, while a reconstructive procedure after injury usually would. Understanding this helps nurses educate patients about the importance of pre-authorization and help prevent delays or unexpected expenses. Before a patient is admitted to the hospital, there are several pre-admission procedures and requirements that must be completed to ensure a safe and efficient admission process. These steps vary based on the type of admission, but they generally include authorization for admission, admitting department functions, and pre-admission testing such as lab work and diagnostic imaging. Let's begin with authorization for admission. Most hospitals require prior authorization from a patient's insurance company, also called a third-party payer, before a non-emergency admission. This authorization confirms that the insurance carrier agrees the admission is medically necessary and will cover the cost of care. The physician's office typically handles this step. However, if authorization is denied, it means the insurance company has refused to accept payment responsibility, often because the procedure isn't medically necessary or is considered elective, such as cosmetic procedures like facelifts or breast augmentation. As nurses, understanding this process helps us educate patients about coverage limitations and prevent financial hardship. Next, the admitting department plays a key role once authorization is complete. Admitting staff verify the insurance approval, collect personal and insurance information, and confirm all admission criteria are met. They may also help patients arrange payment for copays or deductibles. For emergency admissions, these clerical responsibilities often shift to the emergency department staff, who must complete them rapidly as the patient receives urgent care. Finally, pre-admission testing ensures the patient is medically ready for hospitalization or surgery. This can include laboratory work, X-rays, MRIs, Connecticut scans, ECGs, or even blood donation for patients scheduled for surgery. Testing is tailored to the reason for admission. For example, preoperative blood tests to check hemoglobin and coagulation, or chest X-rays for patients with respiratory conditions. Typically, patients are instructed to arrive 1 to 2 hours before the scheduled procedure to complete these final preparations. When a patient arrives on the day of admission, the nurse plays a key role in helping them feel comfortable, safe, and informed. This begins with a warm professional introduction. Always smile, make eye contact, and address the patient respectfully, usually by their last name, unless they indicate a preference otherwise. It's never appropriate to assume that a patient wants to be addressed by their first name, as this can feel too informal or disrespectful in a hospital setting. Start with a professional greeting, such as, "Good morning, Mr. Thompson, I'm Nurse Williams, and I'll be helping with your care today." Next, the nurse should begin the orientation to the nursing unit, which helps the patient become familiar with their surroundings and reduces anxiety. Show the location and function of the call light system and demonstrate how to use it to summon help. Be sure to show both the standard call bell and the emergency call bell, especially the one located near the toilet in the bathroom. Orienting patients to these systems is a vital safety measure to prevent falls and ensure quick access to assistance. Patients should also be shown how to use the television, telephone, and other comfort devices. Small actions like these help the patient feel more independent and at ease. Point out the location of the bathroom and hand hygiene stations, reinforcing the importance of hand washing before meals and after using the restroom. After orientation, the nurse should allow time for questions about the admission or scheduled procedures. Providing clear, simple explanations builds trust and reduces fear. Explain the visiting hours and any hospital policies that might affect the patient's stay. If the patient is not NPO, meaning nothing by mouth, offer to fill their water pitcher. This small gesture shows compassion and attentiveness to comfort. Finally, if available, provide a printed handout containing key information such as staff contact numbers, call procedures, and hospital guidelines. Always ensure the patient has an opportunity to ask follow-up questions and that they understand how to request help when needed. The goal of orientation is not only to introduce the environment, but also to establish a caring nurse-patient relationship based on respect and communication. When a patient is admitted to the hospital, the care of their personal belongings becomes an important safety and ethical responsibility. As a nurse, you must help the patient feel confident that their belongings are secure and properly managed. Begin by assisting the patient to store their personal items in the closet or designated area to prevent loss or clutter. Encourage them to send home anything not essential for their hospital stay, such as large bags, extra clothing, or unnecessary devices. Valuables such as jewelry, credit cards, and money should always be sent home with a trusted family member. If that is not possible, hospitals have specific policies to secure valuables. Obtain a valuables envelope, clearly label it, and arrange for safe storage according to your facility's protocol, typically through the security or admissions department. This step protects both the patient and staff from liability. Patients sometimes arrive with personal electrical items such as chargers, fans, or electric razors. These items must be checked by maintenance staff to ensure they are properly grounded and safe to use within the hospital. This prevents electrical hazards that could harm patients or interfere with medical equipment. Another crucial part of this process is handling the patient's medications. Make a complete list of all medications brought from home, including prescription, over-the-counter, and herbal preparations. This ensures accurate medication reconciliation. Once the list is complete, send these medications home with a family member to prevent duplication or medication errors during hospitalization. If no one is available, store them securely per facility policy. As part of your nursing duties, notify the physician of any medications that the patient takes at home, but that are not listed on the admission orders. Many patients take supplements or non-prescribed remedies that could interact with hospital-prescribed medications. Reporting these ensures patient safety and allows the provider to adjust treatment if needed. On the day of admission, one of the most critical tasks is completing the initial nursing assessment. This establishes a baseline of the patient's physical and psychological status and helps guide individualized care planning. In most acute care settings, the initial comprehensive assessment must be completed by an RN in accordance with facility policy, the Nurse Practice Act, and the facility's nursing policy and procedure manual. However, as an LPN, you play a vital role in contributing to the data collection process. You observe, measure, and report findings that assist the RN in forming the complete assessment. Hospitals often use structured checklists or electronic health record templates to document admission findings. While checklists provide efficiency, narrative documentation is still required to describe patient-specific observations, symptoms, or abnormal findings. For example, simply checking a box labeled "skin intact" is not enough if you observe bruising or redness. Those findings must be described in detail. Narrative charting gives context and supports clear communication among the care team. The admission assessment includes evaluating key areas of functioning and health. The nurse must assess level of consciousness, such as whether the patient is alert, drowsy, or disoriented, which is crucial for detecting neurologic issues. Vital signs, temperature, pulse, respirations, blood pressure, and oxygen saturation provide an immediate snapshot of the patient's physiological stability. Respiratory effort or difficulty should also be documented. Note whether the patient uses accessory muscles, has labored breathing, or exhibits cyanosis. Next, assess the patient's ability to communicate. Is their speech clear and appropriate, or is there slurring, aphasia, or difficulty understanding questions? Assess vision and hearing, noting whether the patient wears glasses, contacts, or hearing aids and whether they can use them safely. The condition of the skin must be inspected carefully for breaks, bruises, abrasions, pressure areas, rashes, dryness, or wounds. Early detection of skin issues prevents complications such as pressure injuries. The nurse should also assess for prosthetic or assistive devices such as dentures, eyeglasses, hearing aids, canes, walkers, or limb prostheses, ensuring they are intact and within the patient's reach. Finally, document any other health problems or concerns expressed by the patient. These may include pain, anxiety, or social or cultural needs that could affect care. Accurate documentation of all findings, both normal and abnormal, is essential to ensure continuity of care, meet legal requirements, and protect patient safety. When a patient is admitted, initiating the health record is one of the first administrative and clinical steps in ensuring safe, organized, and legally compliant care. The health record, sometimes referred to as the medical chart, serves as the official and permanent record of the patient's care and treatment. It includes physician orders, nursing documentation, laboratory and diagnostic test requests, dietary instructions, and consent forms. In an acute care facility, most of this information is documented in an electronic health record (EHR) system. In contrast, skilled nursing facilities or long-term care settings may still use paper records. In these settings, the charge nurse, often an RN but sometimes an experienced LPN under supervision, is responsible for ensuring all admission orders are properly transcribed, meaning that verbal or written physician orders are accurately entered into the medical record, medication administration record, MR, or treatment sheet. The nurse must also prepare and send any required lab requests, X-ray forms, dietary slips, or consent forms to the appropriate departments. Before signing off on these orders, it's critical that the nurse verifies every detail for accuracy. This includes checking patient identifiers, ensuring correct dates, verifying that orders are legible, and confirming that all necessary signatures are complete. Errors or omissions during transcription can lead to medication errors, delayed care, or incorrect treatments, which makes this step a cornerstone of patient safety. Accuracy and accountability are key. If any portion of an order is unclear, the nurse must clarify it with the prescribing provider before proceeding. Once verified, the nurse initials dates and times each transcribed order. This not only fulfills regulatory requirements, but also ensures that care team members have accurate and current information. When a patient is admitted, admission orders serve as the official medical instructions from the provider that guide care during the hospital stay. These orders typically include medications, treatments, diet, diagnostic tests, and activity levels. Once the provider writes or electronically enters the orders, the nurse transcribing or verifying them must ensure complete accuracy before they are carried out. The person transcribing the order should place a check mark beside each order as it is processed to indicate that it has been reviewed and entered into the appropriate areas, such as the medication administration record, MR, laboratory system, or dietary service log. This step-by-step verification prevents omissions or duplication of orders. The nurse should carefully read each lab slip, diagnostic request, and consent form to make sure the patient's information is correct and that nothing is missing. If any discrepancies are found, such as missing dates, incomplete physician signatures, or unclear instructions, they must be corrected before proceeding. Once all orders are verified, the nurse draws a line along the left margin of the completed orders to show that every item on the page has been checked. The nurse then signs, dates, and records the time directly beneath the last verified order and the provider's signature. This notation documents accountability and provides a clear record of who confirmed the accuracy of the orders. If an error is made during transcription or documentation, it should never be erased or obscured. Instead, the correction must follow legal documentation standards. Draw a single line through the error, write error, and include your initials, date, and reason above the line. This ensures transparency and compliance with facility and legal policies. Finally, nurses must also note patient allergies according to institutional policy. Allergy information must be prominently displayed in both the medical record and at the point of care, such as on wristbands or electronic alerts. Accurate allergy documentation is crucial to preventing serious medication reactions or treatment errors. When a patient is admitted to a healthcare facility, it is important to remember that the experience can be emotionally overwhelming. Many patients experience anxiety and fear about what will happen to them, how serious their condition may be, and whether they will receive good care. They may also worry about being away from home, family responsibilities, pets, or their job. Financial concerns are common. Patients often wonder how they will pay for care or cover lost income. Others may have fears about privacy, particularly when multiple staff members are involved in their care or when sensitive health issues are being addressed. Patients can also experience feelings of loneliness, vulnerability, or loss of identity once they are admitted. Being in a hospital gown, confined to a bed, or following strict routines can make them feel like they've lost control over their daily life. As nurses, we must recognize that admission is not just a medical process. It is a major life stressor that affects both emotional and psychological well-being. There are several strategies nurses can use to comfort and support anxious patients. Begin by establishing trust through communication. Introduce yourself, make eye contact, and use the patient's preferred name. Speak calmly and clearly, explaining what will happen next and why. Reducing uncertainty helps ease anxiety. Encourage the patient to express their fears or concerns and listen actively without interruption. When appropriate, involve family members or support persons in the admission process to provide reassurance. Promoting a sense of control and involvement can also reduce anxiety. Offer choices when possible, such as choosing meal times, adjusting lighting, or deciding when to rest. Respecting privacy and maintaining dignity are equally important. Always close curtains, cover the patient during procedures, and knock before entering their room. Finally, comfort measures like touch, relaxation techniques, soft music, or guided breathing can help calm nervous patients. If emotional distress is severe, collaborate with the healthcare team to involve a social worker, chaplain, or counselor for additional support. Compassionate, patient-centered communication helps patients feel seen, respected, and safe during a stressful time. After a patient is admitted and assessed, the nurse begins developing the plan of care, which serves as the blueprint for individualized nursing actions and interventions. This plan is a written, organized guide that addresses the patient's needs, priorities, and expected outcomes. The creation of this plan begins during the assessment phase and continues throughout the patient's stay as new data are gathered or as the patient's condition changes. The plan of care is developed by the nurse, often the RN, but it is a collaborative effort involving input from the entire healthcare team. This includes LPNs, nursing assistants, physicians, therapists, dietitians, and social workers. Each team member contributes their perspective to ensure the plan is holistic and patient-centered. For example, the dietitian may address nutritional needs, the physical therapist may focus on mobility, and the nurse focuses on interventions related to comfort, safety, and education. At its foundation, the plan of care is built upon the nursing process, a structured, systematic approach that includes assessment, diagnosis, planning, implementation, and evaluation. For LPNs, the role involves collecting patient data, implementing portions of the care plan, and communicating observations to the RN to help evaluate outcomes and update goals. The nursing diagnosis, established by the RN, identifies the patient's actual or potential health problems, and the plan of care outlines how to address those problems through measurable goal-oriented actions. For example, if a patient's nursing diagnosis is anxiety related to unfamiliar hospital environment, interventions might include explaining procedures in simple terms, encouraging questions, and providing reassurance. The effectiveness of those interventions is then evaluated and adjusted as needed. Patient transfers are an essential part of hospital care and must be handled carefully to maintain safety, communication, and continuity of treatment. Transfers can occur within the same facility, such as from a medical surgical unit to intensive care, or between different facilities, such as from a hospital to a skilled nursing or rehabilitation center. The key goals during a transfer are to ensure accurate communication, complete documentation, and the safe movement of both the patient and their belongings. When a patient is being transferred, the physician must be notified immediately and provide approval for the move. The reason for the transfer, such as a change in condition, need for specialized care, or discharge to a lower level of care, must be clearly documented along with a description of the patient's current status. This includes vital signs, recent treatments, and any special precautions. The nurse caring for the patient must give a verbal or written handoff report to the nurse on the receiving unit. This report should follow the SBAR format, situation, background, assessment, and recommendation, to ensure all critical information is communicated. The handoff should include the patient's diagnosis, current treatments, IV access, allergies, safety risks, and pending tests. Clear communication prevents errors and helps the receiving team prepare for the patient's arrival. All personal belongings must be transferred with the patient, including clothing, glasses, hearing aids, dentures, mobility aids like canes or walkers, and personal devices. It's important to check bedside tables and drawers for small items that can easily be overlooked. Label all equipment, such as walkers or wheelchairs, with the patient's name written in large letters on tape to prevent loss. If the patient brought personal medical devices, like a CPAP machine, verify they are safely transported and accounted for. The business office or administrative department should also be notified of the transfer to ensure proper billing and record management. If the patient is leaving the facility, copies of medical records, consent forms, and prescriptions should accompany them. Before the transfer, nurses should ensure that vital signs are stable, lines or drains are secure, and the patient is appropriately dressed for transport. A loss of belongings can occur during this process, so meticulous attention to labeling and documentation protects both the patient and the healthcare facility. The discharge process marks the completion of a patient's stay in a healthcare facility, but it actually begins at the time of admission. This proactive approach, called discharge planning, ensures that the patient's transition out of the hospital is safe, smooth, and well coordinated. As soon as a patient is admitted, the healthcare team, often including a discharge planner or case manager, begins identifying what the patient will need after discharge. This may include home health care, rehabilitation, durable medical equipment, or community resources. When it is time for discharge, the primary care provider, physician, or advanced practice nurse writes the official discharge orders. These orders specify when the patient can be released, what medications or treatments must continue, and any follow-up appointments required. The nurse plays a vital role in implementing these orders, ensuring that the patient understands the discharge instructions and that all final tasks are completed. Before discharge, the nurse should assist the patient with notifying family members or significant others, collecting all personal belongings, and preparing for transportation home or to another facility. The nurse must also ensure that any valuables stored in the hospital safe are returned to the patient and signed for according to facility policy. If the patient is being discharged to another healthcare facility, the receiving location must be given complete documentation, including a summary of diagnoses, current medications with the last dose given, provider contact information, and a brief overview of the hospital stay. This continuity of care prevents gaps in treatment and reduces readmission risk. For patients discharged home, the RN prepares written discharge instructions that cover medications, wound care, diet, activity restrictions, and when to seek medical attention. As LPNs, you may be responsible for reinforcing these instructions, reviewing them with the patient, and ensuring comprehension through teach-back methods. You should also observe for any signs that the patient may need additional support, such as a social worker referral for those without transportation, caregivers, or adequate resources. Remember, safe discharge is not just about sending the patient home. It's about ensuring that the patient has the tools, knowledge, and support necessary to recover successfully. When a patient cannot safely return home after hospitalization, the next step may be discharge to an extended care or rehabilitation facility. These facilities provide continued care for patients who still need medical monitoring, physical therapy, wound care, or assistance with daily activities. The transition to these settings must be carefully coordinated to ensure continuity of care and patient safety. At the time of discharge, the RN completes a detailed patient information sheet for the receiving facility. This sheet acts as a handoff document that provides all essential medical information the new care team needs. It includes the patient's primary and secondary diagnoses, current orders, medication lists, including prescription over-the-counter herbal and dietary supplements, and the dose, route, frequency, and time of last administration. It also lists the patient's physicians, important contact numbers, and a brief summary of the hospital stay. All records that must accompany the patient, such as lab results, imaging reports, or wound care instructions, should be placed in a sealed envelope before transportation arrives. This prevents delays and ensures the receiving team has accurate and current information immediately upon admission. It is ideal, though not always possible, for the discharging nurse to call the admitting nurse at the new facility to provide a brief verbal report. This communication reinforces safety, prevents errors, and gives the new team a chance to clarify any questions about the patient's care. For LPNs, your role in this process may include gathering and organizing the patient's belongings, ensuring all documentation is ready, and confirming that transportation arrangements are in place. You also play a key role in helping the patient and family understand what to expect during the transfer and in providing reassurance during what can be an anxious time. Clear communication and attention to detail during this process are critical to maintaining trust and ensuring the patient's care continues smoothly. When a patient is being discharged home, the nurse's goal is to ensure that the patient leaves the facility safely, informed, and confident about continuing care at home. Before discharge, it's essential to verify travel arrangements. For example, ensuring that a family member or caregiver is available to provide transportation, especially if the patient has received sedating medication or cannot travel independently. Nurses should confirm that any necessary medical equipment, such as oxygen or a walker, is available at home or will be delivered prior to arrival. The nurse then prepares and reviews written discharge instructions with both the patient and family members. These instructions summarize all the important information needed for home recovery, including prescribed medications with name, dose, route, frequency, and purpose, activity limitations, special diet instructions, wound care, and follow-up appointments. The primary care provider's name and contact number should also be listed so the patient knows whom to contact for questions or complications. It's important for the nurse to take time to review each part of the discharge form in clear, understandable language, especially with older adults or patients with low health literacy. The nurse should encourage the patient to ask questions and use teachback, asking the patient to restate instructions in their own words to verify understanding. Written instructions should always be provided in addition to verbal explanations to ensure retention and compliance. For LPNs, your role during home discharge often includes reinforcing education, ensuring documentation accuracy, and confirming that the patient's needs are met before they leave. You might also check that personal belongings and valuables have been returned and that the patient is dressed appropriately for the weather and mode of transport. Attention to these small details reflects professionalism and patient-centered care. Home health care allows patients to receive professional medical services in the comfort and safety of their own home. It is a vital part of the continuum of care, especially for individuals who are recovering from illness, surgery, or managing chronic conditions but no longer need the intensity of hospital care. Skilled nursing services may include wound care, diabetic management and education, medication administration, including IV therapy, and monitoring of vital signs or disease symptoms. As an LPN, your role may involve performing ordered treatments, assisting with medication administration, observing and reporting changes in condition, and educating patients and families about home care, safety, and infection prevention. In addition to nursing, home health services often include physical, occupational, or speech therapy, which help patients regain strength, mobility, and independence. Respiratory therapy may also be provided for patients with chronic lung disease or those using oxygen or tracheostomies. Personal care, such as bathing, dressing, or meal preparation, is frequently performed by a home health aide under the supervision of a nurse. The benefits of home health care are significant. Patients experience greater comfort in familiar surroundings, reduced exposure to hospital-acquired infections, and often lower costs compared to inpatient care. Emotional well-being can also improve when patients remain close to loved ones and maintain their daily routines. From a nursing perspective, home health care emphasizes patient autonomy, family involvement, and individualized teaching that supports long-term health management. Insurance coverage for home health services varies. Medicare, Medicaid, and many managed care or private insurance plans will cover portions or sometimes all of these services, provided that a physician order is in place and eligibility requirements are met. Nurses should always verify coverage and coordinate with the care team to ensure that services are appropriately documented and authorized. When a patient chooses to leave the hospital against medical advice, AMA, it can be a difficult and emotional situation for both the patient and the healthcare team. As nurses, we must remember that patients have the legal and ethical right to make their own decisions about their healthcare, even if those decisions go against professional recommendations. The key responsibilities of the nurse in this situation are to ensure that the patient is fully informed, treated respectfully, and that all actions are clearly documented. First, the nurse must make sure the patient understands the risks of leaving before treatment is complete. This includes explaining possible medical complications, the potential for worsening illness, or even death if care is discontinued. The nurse should offer the patient an opportunity to speak with the physician or supervising nurse to review the situation and answer any questions. Sometimes, a calm conversation with the healthcare team can help patients make more informed choices or address fears and misunderstandings. If the patient still decides to leave, they should be asked to sign an AMA form. This document confirms that the patient was advised of the risks and is choosing to leave voluntarily. If the patient refuses to sign, the nurse must still document the refusal in the nursing notes, along with details about the teaching provided and any witnesses present. It's also important to document that the physician was notified immediately. Nurses should also inform the patient that leaving AMA can have financial implications. Insurance carriers may refuse to pay for hospital costs incurred up to that point, making the patient financially responsible. Patients should also be told that they might not receive discharge prescriptions or referrals since care is being discontinued without medical approval. Every discussion, patient response, and intervention must be recorded in the medical record to ensure legal protection and continuity of care if the patient returns. As an LPN, your role includes communicating calmly, ensuring informed consent, and supporting patient autonomy while maintaining professionalism and safety. Never attempt to physically stop a patient from leaving, but always take steps to keep them safe, such as removing IV lines properly, ensuring they're not impaired, and documenting all actions accurately. When a patient dies, the nurse's role extends beyond clinical care. It becomes deeply human and compassionate. The death of a patient is often an emotional experience for family members, caregivers, and even the nursing staff. It is essential that nurses provide both emotional support and professional guidance to help those affected begin the grieving process. The most valuable gift a nurse can offer to the bereaved is often presence, simply being there, listening, and allowing them to express their emotions freely. Remember, grief is a normal and necessary process of healing, and people experience it differently based on their culture, spirituality, and personal beliefs. Encourage family members to take the time they need at the bedside to say goodbye, and if appropriate, offer to contact a priest, minister, rabbi, imam, or other spiritual advisor for comfort and prayer. Nurses should be sensitive to the family's emotional and cultural needs. What brings peace to one family may differ for another. From a procedural standpoint, once death occurs, a physician must officially pronounce death. This cannot be done by an LPN. The nurse's responsibility is to document in the chart the time life signs ceased, the time of the official pronouncement, and the name of the person making that pronouncement. This documentation must be precise and factual. If family members are present at the time of death, it is appropriate to remain calm and offer support, allowing them privacy when they're ready. In some cases, autopsies may be required, such as when a patient dies of unknown causes, suspected homicide, or without recent medical evaluation. Families may also request an autopsy voluntarily for personal or research reasons. The coroner or medical examiner authorizes and oversees autopsies in these cases, following state laws and facility policy. Autopsies may also provide valuable information for medical research or quality improvement. The next of kin must give written permission if an autopsy is not legally mandated. Throughout this process, the LPN plays an essential role in supporting the family and ensuring the patient is treated with dignity and respect after death. The nurse should follow facility procedures for post-mortem care, such as cleaning the body, removing medical equipment per policy, and preparing the body for transport while maintaining the patient's modesty. Compassion, professionalism, and cultural sensitivity are key elements in providing end-of-life care. Organ donation is one of the most profound ways that life can continue even after death. It gives families an opportunity to find comfort in tragedy, knowing that their loved one's gift can save or improve the lives of others. Nurses play a key role in supporting this process by demonstrating compassion, professionalism, and cultural sensitivity. Organ donation may be requested by the patient prior to death, often through an organ donor registry, a driver's license notation, or an advance directive. If the patient's wishes are not known, the discussion about donation may occur with the next of kin after death. These sensitive conversations are typically handled by a physician or a specially trained organ donation coordinator, not by the LPN. However, LPNs must be prepared to support the family emotionally and to understand how the process works to ensure appropriate coordination of care and respect for the patient's wishes. When approached with empathy and respect, organ donation discussions can offer families a sense of hope and purpose during their grief. Many families report comfort in knowing their loved one helped others live longer, healthier lives. At the same time, it's critical to recognize that cultural, spiritual, and personal beliefs strongly influence attitudes toward organ donation. Some families may view donation as a sacred act of generosity, while others may oppose it based on religious or cultural traditions. Nurses must avoid judgment and instead honor each family's values and choices while ensuring that accurate information is provided. The need for donor organs is ongoing. Thousands of people in the United States are on transplant waiting lists at any given time. Each organ donor can save up to 8 lives and improve the quality of life for many more through tissue donation. Healthcare workers must maintain awareness of this growing need, understand the legal and ethical aspects of organ donation, and ensure that policies and consent procedures are followed precisely. This ends the presentation. Thank you.